Well, sorry to disappoint. This isn't Dr. Peter Glidden. This is Dr. Heather Rooks filling in for him. Thanks for listening today. Before the break, we had Erica from New Jersey on the line, and we're going to continue with her issue. Erica, are you there?
Yes, I am. Actually, I just wanted to add something really quick. I've been having Atlas orthogonal treatment.
Okay.
And
Atlas
previous
orthogonal?
to that,
okay, good.
Yeah, previous to that, I was having a chiropractor treatment, but the person that's doing the Atlas orthogonal is not. He recommended that I no longer get chiropractor treatment, and I do have a bulging disc and narrowing as well on the neck area between, I think, C4 and C5.
Okay. Well, let's just get clear, okay? First and foremost, that Atlas orthogonal is simply a technique within chiropractic, okay? So the doctor who is delivering the Atlas orthogonal adjustments has the same credentials as the chiropractor who's delivering what might have been a full spine or what's called a diversified adjustment. However, very different in approach, correct? Just want to kind of educate you on that, okay? So the Atlas orthogonal is simply just a technique within chiropractic. So you still are receiving chiropractic care, which is fantastic. And Atlas orthogonal is a very, very good upper cervical specific technique, so you're getting the right approach. Now, if you're getting Atlas orthogonal chiropractic adjustments and you're still having some issue, then that means that it's something nutritional in your diet and in your body. So the fact that you're receiving some chiropractic care is great, whether it's Atlas orthogonal or traditional. I actually tend to do more low-force chiropractic myself. What we need to address now, Erica, is what might be happening on the internal workings or the biochemistry of your body that's contributing to this exostosis or bony buildup in your inner ear canal, okay? And from my point of view and from the point of view of the doctors that created the products for longevity, what's happening is you actually have a calcium deficiency that is actually promoting the bone buildup. I know that sounds very strange. However, the body has a funny way of working sometimes. And within what the scope of practice of what I do in order to promote and support the structure and function of your body's ability to build healthy new bone and tissue, whether it's in the ear or in the spine or in the leg, etc., what it sounds like you need is what's called the Healthy Bone and Joint Pack. All right, and that's a combination of products that Longevity offers. What I would like to do and explain to you what comes in that, and then I'm going to put you through to my support person so that they can talk to you a little bit more about it and see if that would be something that you would want to try. Because to be honest, if you're getting chiropractic, then it's the nutrition piece that's lagging, okay? Typically, there are 90 essential nutrients that your body needs that you would get in this pack. There are 3 products that provide those. One is a multivitamin and mineral supplement that we call Tangy Tangerine. The other is the joint and bone support formula, and then the essential fatty acids. That makes up your 90 essential nutrients. Those all come in that Healthy Bone and Joint Pack. Now, secondary to that would be some assistance for you in order to actually get your bones and the calcium levels just right, and to make sure that you're not building up too much calcium in your inner ear canal. And that's exactly what exostosis is, okay? So we're going to need to know what your body weight is to actually be able to tell you how to take that. And in that same pack is going to be a cream, which is called TM cream. And if your TMJ or that ear canal gives you any pain, you can actually apply that just to this area of discomfort to get some serious pain relief, as well as your body's working to repair from the inside out, okay? Are you taking currently any of the Longevity products?
Yes, I am. I'm taking Beyond Tangy Tangerine and Cow Toddy. I started taking that 3 times a day, breakfast, lunch, and dinner. Okay. And also Glucogel and EFAs.
Okay, and how long have you been taking that?
I'm going to be honest with you. I've been taking it on and off for a year. I haven't been consistent with it. Okay.
Okay. And as far as your diet is concerned, are you following the good food / bad food list and staying away from the 10 bad foods?
100%.
Okay, great. And do you have any other existing diagnoses in regards to your health that you could share with me? Is there anything else going on?
No, just that and that.
Okay. Okay. Are you on medications of any kind?
Yes.
Okay. All right. So that's something else that we may have to talk about to see if that's contributing to the issue. Just an FYI. Are you having any other bony issues besides the ear? I know you said that you're having some TMJ problems, but when you said the right lateral, are you talking about on the skull or are you talking about in your knee? What are you talking about?
I was just reading a report that they gave me. It's pretty much where the condyle is.
Okay.
By the
All right. So
jaw,
Okay.
and there's a little bony protrusion sticking out.
Okay.
That's also pushing up the little disc by the condyle.
Gotcha. So here's what I recommend. If your Atlas orthogonal person is doing your chiropractic adjustments to the Atlas specific, that's fantastic to clear your upper cervical neck, spine. However, I'm concerned that you're not dosing. You really have to give this a fair shot. You have to make sure that you're doing the protocol for 90 days. Every day, not on and off every single day. You also need to make sure that you're dosing appropriate to body weight. Okay, that's the other big thing. Make sure you're taking the right amount for your body weight. And to be honest, you're already, over 50 to 60% of the way there if you're doing the good food, bad food list. It sounds like you're on the right products. It's just a matter of application, to be honest with you, okay? Application. What I would recommend is make sure you're doing it consistently to body weight. So the Tangy Tangerine, do you mind telling me your weight?
No, not at all. 100 pounds.
You're 100 exactly?
Yes.
Okay. So then for you, it's going to be pretty easy. That's boilerplate. So for the Tangy Tangerine, you need 2 scoops every day. You need to make sure you're getting enough water with that. For the or you said you're taking the Cal Toddy, is that right? For your calcium supplement? Okay. And you're doing that 3 times a day, 1 ounce?
Yes.
Okay. When did you increase that?
I increased it probably like 4 days ago.
Okay, so you just started doing that. Okay. You can do that for a while as far as loading it up. And then with the glucogel, we're supposed to take 1 of those for every 10 pounds of body weight. Are you doing that? Are you doing 10 per day?
I was doing 5, but I can double it right now.
Yeah. So that's the thing, is that with this clinical nutrition, it's all about the application of the protocol. So what I would do is for 90 days, commit yourself to doing exactly the way that you're supposed to be doing it, which would be 2 scoops of the Tangy Tangerine, 10 of the glucogel, and you can split them up. You can take 5 in the AM and 5 later. All right. You want to make sure for sure you're getting at least 2 ounces of the Cal Toddy. Okay? And you need to make sure you're also taking the essential fatty acids if you're not.
Okay.
Yeah. So do it for 90 days, and, I'll be coming and going. I'll give you my office information, and if you have further questions or follow-up, you can certainly call me. And as you know, Dr. Glidden's on the air Monday through Friday. Typically, you can always call back in. But for sure, application of the protocols is going to dictate how successful they are, okay? So let's commit to 90 full days, 3 full months of doing the products every single day, okay?
Okay.
All right, and my contact number at my office is 484 area code 775-0550. You can find my office on Facebook at PATH, P-A-T-H, Integrative Health Center. And we're also on the web at pathhealthcenter.com, which that website's under construction. If you have any questions in regards to how to dose the supplements, you can call my support line, which is 302-339-1245.
All right, sounds good.
Okay, and Erica, you're so welcome. If you're not getting any resolution with that TMJ as well, you might want to ask your Atlas orthogonal specific chiropractor if he knows anyone who does cranial work, particular to where the jaw is aligned within the actual cranium by the ear canal, because that may be a contributing factor as well.
Okay, thank you so much.
Okay. You're so welcome. Have a great day.
You too. Bye.
You're welcome. Okay, guys, so there's a perfect example. Erica's on the right track. She just needs a little push in the right direction. When Dr. Wallach created these protocols, they are amazing. However, they're not magic. You do need to apply the protocols as indicated in the product manuals. And as Dr. Glidden and Dr. Wallach recommend, if you don't apply the protocols to your body weight, you may not get the optimal results. Now, have Has she gotten some change? You know, possibly, but has she gotten full resolution of the issue? Not of yet. So let's see if Erica can do the 90-day challenge, as I challenge everyone else to do the 90-day challenge to always be sure that you're dosing appropriate for body weight. Now, moving on to another topic, I usually get a lot of questions in regards to spinal arthritis and different arthritides that affect the spine, and many of the patients that I encounter have been told by orthopedists and neurosurgeons alike that it's normal. It's just normal, Mrs. Jones. It's normal to hit 50 and just have everything break down. So what we're going to do is we're going to replace both your knees, give you 2 metal hips, and then if necessary, you know, pretty soon they'll be trying to do brain transplants. Who knows? That doesn't work, guys. That doesn't fix the reason why the body can't repair itself. There's an underlying reason. Your body does not just haphazardly go off and start doing whatever it wants. It's supposed to be applying the nutrition that you're taking, and your brain is supposed to be communicating with your body parts, and it is a very intricate and fine-tuned system. It's 4 trillion cells operating all together under the control of your brain. So with that being said, how many times a day do you think I hear, hey doc, I still have knee pain, hey doc, I still have hip pain, hey doc, I still have neck pain? And one of the things I must stress to you is the importance of following the good food and bad food list. You've got to get the bad foods out. You've got to stop the inflammatory process. If you are consuming foods on the bad food list which contain gluten, are fried foods, anything, oils out of a bottle, nitrates and nitrates in deli packaged meats, if you are consuming artificial sweeteners and you're consuming skins of baked potatoes that have been baked, you are consuming oxidized food. You are consuming food that creates inflammation in your body. If you're consuming that, your medical doctor is going to love you because you will always be in his office, because you will always have a problem, because your gut and your intestinal working will always be inflamed. And in a chronic inflammatory state, there's no way that your body can break down your food and absorb nutrients, whether it's in the form of food or it's in the form of supplements. It's just not going to happen. So if you're already taking longevity products, but you're not adhering to the good food, bad food list because it's quote unquote too hard, you're doing yourself a major disservice. That is a very important aspect to the application of the protocols. All right, guys, we're up against the hard break. See you when we return. Welcome back. This is Dr. Heather Rooks filling in for Dr. Peter Glidden on Fire Your MD Now. I believe we're going to go to the phones. We have Moina from Delaware on the line.
Hello, Dr. Rooks.
Hi, Moina.
Hi, how are you?
Oh, great. Good to hear from you.
Good, good. Yeah, it's good to talk to you. I love your show.
Well, thank you. I'm happy to sit in for Dr. Glidden. This is a first, but I'm actually having fun, so here we go.
I have a couple questions. I've been following Dr. Glidden and listening to his application of for arthritis and the glucogel and how many you take for arthritis. And he said 1 per every 10 pounds.
Correct.
Is that okay? Is that continuously forever or just for?
The recommended dose is 1 of the glucogel capsules for every 10 pounds of body weight.
Right.
For 90 days.
For 90 days.
Yeah, for 3 consecutive months. That's like a kind of what we would call a treatment protocol.
Okay.
And then thereafter, it does depend on the chronicity of how long things have been going on for people. And then thereafter, there's a maintenance dose that you can move to, as far as, you know, once you get it under control, and we can help support and promote your body's ability to heal from the actual bone that's been laid down and relying the cartilage on the joints. You can change that quote unquote treatment dose or, you know, building up phase into more of a maintenance dose, which would probably be somewhere between 4 and 6 a day. That's what I typically use with my patients. That's what I typically recommend.
Right.
And we know now too that Longevity does also offer the liquid glucogel, which is a newer formulation, I believe. I typically use the capsule format, which is got the powder in the, you know, gelatin capsules, but they also have a liquid glucogel as well that could be tried.
Right. I use the capsule. That's what I like.
That's what I like too.
I'm on a 6 to 8 dose, and I'm doing very well. But I have friends that are I have a friend who has osteoporosis in his back, and he is shrinking from 6'1" to like 5'5". It's sad to see.
Well, right, and most of the time as people age, they will shrink a bit, and what happens in that shrinking process is the first thing to go is actually the gel discs that are between the spinal vertebrae, which we call the intervertebral discs. They act as a cushioner and a shock absorber so that when your body's going through motions, you know, you're not bone on bone. But as people age and they're not nutrified, what tends to happen is we start to first lose those discs. And I like to make the analogy of that disc being like the cream of an Oreo cookie. All right, and so it's the cream between the two hard, cookies, which would be the bones. And if you don't support that, you don't hydrate the body properly, you're not getting proper nutrition, you don't move the body, then what happens very commonly over time is people start to lose height first in the discs. And that happens first and foremost from dehydration and denutrification. And then over time, once the discs start to go, what will happen is very commonly people will start to actually have osteoporosis. So osteoporosis is where you actually are starting to get the actual matrix of the bone breaking down. So the inner matrix of the bone, there's two parts. There's like the outer part of the bone, which is the hard bone, we call that. And then inside is like spongy. It's like a sponge. If you can actually look through it, it's almost like a matrix or multiple screens kind of layered on top of each other that you can see through. But yet that's called our spongy bone because it's actually soft. And what will happen is that hard cancellous bone on the outside will start to break down. And when we start to get bone density loss and we start to get disc loss, we start to get basically that shrinking effect. So when we have a change in height as we're starting to age, that's actually tissue of the discs of the spine and the spine itself losing tissue. That's actually what's happening with that. It is avoidable. It is avoidable. And the traditional medical approach to that is to throw them on particular medications that have shown to actually do the opposite. Continue to break the bone down. With the longevity protocol, we can support and promote the healthy building up of bones, even in someone who has osteoporosis, osteopenia, which is that first step towards osteoporosis, and then even people who have gone beyond, a mild osteoporosis into a very severe osteoporosis and now are basically bone on bone, where they have mass arthritis running through their spine because they're basically bone on bone. So that's what's happening to your friend. If you can hold the line, we have to go to a break, and we'll be back and continue talking to Moina from Delaware. Thank you. Welcome back to Fire MD Now with guest host Dr. Heather Rooks filling in for Dr. Peter Glidden. Before the break, we were speaking with Moina from Delaware, my backyard, who was concerned for her friend who has gone from, 6'1" down to 5 foot. What was it that you said, Moina?
He's about 5'4", 5'5" now. I mean, he's really had a hard time, and he's in pain. The only time he isn't is when he actually just sits down.
Wow, poor guy.
And
so
that can't be reversed, right? But it can be stopped?
Here's what I typically talk to people. In that case, this gentleman has undergone extreme disc loss as well as osteoporosis as well as pretty advanced let's just give you the layman's term, arthritis, okay? Osteoarthritis or degenerative joint disease, degenerative disc disease. Those are all the same terminology for the fact that the guy's bones are now in his spine are bone on bone, all right? So the cookies are crumbling. Earlier I was making the analogy of the bones being the cookie of an Oreo and the cream being the disc. He's actually got advanced osteoarthritis that has got to be going on in his spine at this point if he's lost that much height. And there are different stages to that happening. So to answer your question, if he is in an advanced stage 3 or 4 of osteoarthritis, that is where the bones actually start to what we call ankylose, and that is where the internal mechanisms of the body are actually starting to fuse the spinal bones together. And that is a protective mechanism to protect the brain and the spinal cord particularly, and the spinal nerves. So this particular condition cannot be reversed. The only thing that can be done at this point for someone in that condition is to actually help to stop the progression of that from happening. So, good question. He's lucky to have a friend like you who's so concerned, but if he is going to get serious about doing this, he's going to have to participate in Longevity's medical nutrition and get involved by getting right into a healthy bone and joint pack again with the use of some of the CM cream, which is a great topical pain reliever, and he's got to change his diet if he's not doing the good food, bad food list that we highly recommend. That's the key.
Yes, absolutely.
Now, is there anything else that you wanted to share with us, Moina?
No, I think that's it. I think that my concern basically with most people I run into, such as this gentleman, that they just don't realize that their body can help themselves with the right nutrition, that they can actually, without medical intervention, get better.
Right. And that's a shame because unfortunately they, along with 80 million other people in this country, have been brainwashed. They've been brainwashed by the medical establishment. They've been brainwashed by the direct consumer advertising of pharmaceutical companies, which I personally think is criminal. They've been brainwashed to believe that the power in the prescription bottle is greater than the power of their body to repair and heal itself. And it's hogwash, because if you just remind them that how were they born, how did they come to be, the intelligence within one egg and one sperm came together, and within 3 weeks the nervous system was there, and that nervous system then coordinated and controlled the function of everything else in their development. They put more emphasis in a pill bottle than they do in that power of the body to create. And that is sad, and they've been brainwashed by the medical community, and you have to just keep telling the story and fighting the good fight and letting people know that they do have the ability to recover and to heal from major things, even if they're limited, Machiavellian thinking medical doctors telling them that they cannot. They can. They can. So thank you so much for calling.
And is that it's easier to do it the medical way.
Of course it's easier, because it doesn't have there's no self-responsibility. It's don't do anything, just do what you normally do, put a blindfold on and walk around, eat whatever, drink whatever, do whatever, and when something breaks down, come to us, the almighty knowing medical doctor, and we will fix you. And they never fix anything. All they do is manage symptoms. That's all they do. That's all they've been trained to do. That's all they know how to do. And unfortunately, your friend at this point in his life has been led down that path, and it's been the wrong one. So you try to talk to people as much as you can. You try to tell them the truth, and to be honest with you, the best you can do is lead by example, which I know you're doing in your community. And if people want to jump on board and know more, you know where to send them. Send them to Dr. Glidden's radio show, or refer them to my website, pathhealthcenter.com, or Path Integrative Health Center on Facebook, or have them call my office. Anybody can call 484-775-0550, and we'll get them the information that they need to help promote and support their body's ability to heal. Thanks again, Moina.
Thank you.
Great. And I believe we have another call on the line. Is Mandy there?
Hi, Dr. Rooks.
Hi, Mandy. How are you today?
I'm well, thank you. So I am a nurse practitioner in the state of Delaware, a family nurse practitioner, and I find myself somewhat conflicted, the information that I get as far as fluoride supplementation for our pediatric population and then up into adulthood. The kids are getting the fluoride treatments. They're getting the fluoride in their toothpaste. Our city-based water is being treated with fluoride as well. Can you kind of enlighten me with your opinions of the pros, if there are any, and the cons of all of this fluoride supplementation?
That's a great question. Mandy's a nurse practitioner. Do you know what that means, listening audience? That means that she has the power of the prescription pad. She has the power of the prescription pad in her hand and a responsibility. And she wants more information. So she's better than most with the prescription pad power. And let me tell you a little bit of what I know about fluoride and what I've learned about fluoride. First of all, fluoride, when it's put into our water, can't really be controlled as far as the dosing of who's getting what. Okay, so the theory behind the introduction of fluoride to the water supply initially seemed beneficial, and it was supposed to reduce the incidence of dental cavities in children. But now, we're looking around, and we know that the health dangers far outweigh the potential benefit to the teeth. And to be honest with you, some of the clinical research isn't even showing the benefit to the teeth. People who actually grow up on well water are the ones that are actually doing well as far as their teeth strength and not having cavity production. And what we know about cavity production is that most cavities are being produced because of sugar metabolism and bacteria interaction in our mouth. So most dental cavities are actually being promulgated and promoted by a high sugar diet and a high grain diet, and most of the processed foods that kids and adults eat today is made with high fructose corn syrup. So as far as the benefits of putting fluoride in water, I quite frankly don't see any. In fact, I see way more hazard in putting fluoride in water, because we know that there are only 8 countries in the whole world that are still fluoridating water, which is crazy that United States seems to be one of them. We fluoridate probably 50% or more of our water in this country, and fluoridation of water, in my opinion, is very, very bad medicine. Once you put fluoride in the water, you can't control the dose. You can't control who gets it. There's no oversight. You're actually allowing a community of people, you're actually allowing people in a community to actually be forced to take a particular substance, which is fluoride, which is why my family, we don't drink it. Now, the research has come in, and we know now that actually fluoride can cause harm. We know that it can affect our glandular system, in particular with women, the thyroid. And in my office, I see tons of thyroid clients. I see tons of women suffering from glandular disorders. I've gotten a statistic that over 90% in the tri-state area are affected by thyroid disorders, and I'm pretty sure there's a direct link between the fluoridation of the tap water in our area. We know that the fluoride ions tend to attack the gland tissue, the thyroid, and the pineal gland. Particularly, the pineal gland sits in our brain and actually is in control of several brain functions, our ability to tap into our higher consciousness, our ability to connect to a spiritual realm. And quite frankly, I've even, done some reading and got some information that fluoride is part of dumbing down a society. So as far as I'm concerned, the lowering of IQ, the destruction of necessary glands, and the breakdown of kidneys and bone tissue, that harm that fluoride presents far outweighs the old junk science that was used to promulgate the use of fluoride ions in the water. And that's my opinion, but if you were to get online and do a PubMed search on fluoride articles, and you were to get the opinions of other more natural-based practitioners around the country, I think you'd get the same information. Does that make sense to you?
Absolutely, and that's more of the lines that I have been thinking personally. My family and I drink bottled spring water, and I have gone so far as that I now make my own toothpaste. And the last time that I was at my dentist, the hygienist, we happened to be discussing the toothpaste that I make, and when she asked if I added fluoride to my homemade concoction, and I told her no, she almost had a heart attack. And it didn't really seem like she was in a position to even think outside of that box. So I didn't even travel down that road. But
that's because within her small little mindset, sorry to say that, dental hygienist, in the dental profession, the use of fluoride has been pushed so hard that there's now a group of dentists who have been created who are anti-fluoride because they see what it actually does to people. Okay, so the use of fluoride, what makes me want to jump up and down like a crazy person in the aisles of Target or the general shopping store is when I walk past the fluoridated water that says for babies, the nursery water with the pink label that's got added fluoride. Parents, if you buy that for your child, you are pretty much just guaranteeing that your child is going to have major developmental delays, thyroid, pineal, and kidney problems. I'm telling you right now, that makes me want to jump up and down like a crazy lady in the actual stores. And unfortunately, it's been something that has been promulgated over and over and over in the dental community. And, you know, I know a young woman personally who's a dental assistant and at 31 or 30 years old was diagnosed with breast cancer. I wonder if there's any link between the fact that she's around fluoride all day and has a cancerous growth in her body. I wonder. It begs me to wonder. It begs me to do more research. Personally, I would never give my son fluoridated water. He gets purified water only, whether we're cooking, whether we're drinking out of a bottle, or whether we're doing anything. Small-minded people that work in professions, unlike yourself, Mandy, the nurse practitioner, who's thinking outside the box, they are the ones who have been told a message and they just push it and push it and push it. I wonder if they were told that same fluoride ion could cause cancer, that they might change their tune. I wonder myself. So you stick to your guns. You keep telling your dental hygienist what you know. Put her on to some real information and not allow her to just fill your head with the dogma that she's been fed by the Dental Association. Thank you for calling. Anything else you want to talk about today?
No, Dr. Rooksbury, thank you very much for your insight.
Awesome. You're so welcome. So Mandy is smarter than her peers because she does her own research. She looks into things. She doesn't just accept things at face value. And you got to give her credit. She actually is asking questions. And if you don't ask questions, you're not going to get the right answers. Some of the other things that I see within our community is overuse of medications. Anyone else seeing that? We're against the hard break, so we'll have to discuss this afterwards. We'll see you then. Welcome back to Fire MD Now. This is Dr. Heather Rooks filling in for Dr. Peter Glidden. It's been a pleasure today. I wanted to end the show today by talking about the most amazing product, in my opinion, in the longevity line, and that's the Beyond Tangy Tangerine. The Beyond Tangy Tangerine is the complete multivitamin and mineral complex with the plant-derived minerals as well as the 16 essential vitamins and 12 essential amino acids and the 120 superfruits. I've never in my career and my athletic career seen a multivitamin that can do so much. And now Longevity is also offering the Beyond Tangy Tangerine 2.0 in the Peach Fusion flavor, which I'm pretty psyched to get to change it up from day to day. For the people that are in the listening audience, in my office, I have seen within 60 to 90 days individuals get off medications effortlessly, reverse type 2 diabetes, lose weight, gain energy, and have a better quality life just by adding this one simple product into their diet and into their life. I have never experienced such a huge boost of energy and overall feeling of well-being. It's a natural antioxidant. It's got a great taste. It supports a healthy immune system, supports the cardiovascular health. It's got tons of antioxidants for all those people that are running around working on their appearance from the outside in. Remember, good health and appearance comes from the inside out. The Tangy Tangerine product also supports a healthy digestive system. It's gluten-free, which is a big deal. No artificial sweeteners. It supports optimal health. It's got a low glycemic index, so it's friendly for all the people that are having weight issues, prediabetes, metabolism disorders, and type 2 diabetes, which we know is an epidemic in our country. The promotion of the healthy blood sugar levels through the Tangy Tangerine alone, I've seen major reductions just with people adding this or the plant-derived minerals to their blood sugars. I do a lot of work with type 2 diabetics and thyroid disordered people and digestive disordered people. That seems to be the big three that we're seeing these days in my office. And we do integrate our model of care using vitalistic chiropractic care along with Longevity's plant-derived minerals and all of their clinical, medical, nutritional supplements. We also advocate healthy lifestyle through exercise, stress reduction, and rest and relaxation. So if you are not now currently participating with Dr. Peter Glidden, you're missing out, peeps. You got to get on fireyourmdnow.com with Dr. Peter Glidden and get a subscription. For anybody who is in the tri-state area, if you're interested in seeing someone in an office instead of just talking to them on the phone, or you have real health problems that you're afraid to just start taking some supplements, I'm always accepting new clients. I'm always willing to take new patients, even if I have to work overtime. We are in a health tragedy right now, people. The medical monopoly is killing us all. Number one cause of death in our country is iatrogenic disease. That is doctor-induced. Medical doctor-induced killing is the number one cause of death in our country. Wake up, America. This is a problem. Be an advocate for your own health care. Take control of your health. Find health freedom again. Join Dr. Glidden and Team Glidden. Look for us in the future. I am hopefully going to be putting this message that I have together into a book and spreading the word around the country and doing speaking ideas and speaking events. Our children need us to turn it around for them. They need support in their nutrition. They need to have healthy food supply. We need to take control now. So it's been great being on the show. I really have had a great time hosting today. I hope that people take action based on some of the things that we've discussed. And I also hope that if you're in our area and you're in the tri-state area, that you will consider taking the step forward towards changing your health. If you don't want to call into the radio show and you want to see a doctor one-on-one, please, I'm available. Office, PAC Integrative Health Center. 484-775-0550 is my phone number. Again, 484-775-0550. We really appreciate the listeners tonight and today, and I just want to let you know that it is the people who are like you and I in the grassroots who are going to change the outcome of the medical system if it's going to change. It's not going to happen from your medical doctor. It's not going to happen from the pharmaceutical industry. We want to work on a preventative model and towards a preventative model. We are in a type 2 diabetes and a thyroid epidemic. We have a digestive epidemic growing. We have Alzheimer's going off the charts, children's disorders, autism's 1 in 50. If you don't do something now to change your health future, where will your health be in 5 years? In 5 years, where will you be if you don't change something? Spread the good word. Tell your friends and family and community about the power of longevity and the 90 for life. This is Dr. Heather Rooks. Thank you so much for listening. Hope to be able to speak with you again. Have a great night. Hi.